Hi everyone, my name is Pamela Ponce. I'm a second-year occupational therapy student at the University of Tennessee Health Science Center. The topic for this in-service presentation is Spanish phrases for the entry-level OT practitioner. After this presentation, viewers and listeners will be able to understand the importance of knowing how to overcome cultural barriers through communication, become familiar with commonly used Spanish words and phrases in healthcare, and know about different forms of language translation technology that can be used. Before we get started, we're going to watch a short video.
Nurses and doctors about communicating with deaf patients, and they said that they had received little to no training in school about effectively communicating with culturally diverse patients. And we decided that we wanted to expand from deaf patient and nurse communication into Spanish speaking and nurse communication. We recognized immediately that we had that resource here on campus. We have the Spanish interpreting department. Dr. Brees and I talked about how can we apply this and use it at Upstate. You know, we have this excellent nursing program, and we really wanted to see some collaboration with the communications department.
Students were supposed to learn two things. One, what it's like not to be able to communicate in your own language with the doctor or nurse. And two, which of the scenarios was the best, and by far, you want to have that interpreter present.
If the patient doesn't understand what the doctor told them and how to take their medication properly, they're not going to get better, and they're going to keep coming back and back to the doctor and compounding their problem.
This class was primarily for nursing students, but in terms of working with people who are not speaking the same language as the dominant language of that institution, then doctors also often need training. And we saw that a lot when Tess and I were working with deaf patients, that there was a real gap of understanding.
It's required by law that you have to provide an interpreter. Some of the students weren't aware that that was necessary. There's a huge difference in being bilingual and in being trained to interpret in a medical setting.
The goal of this is to break down some of the barriers between patient and healthcare providers along linguistic and cultural lines. So we're trying to break those barriers down.
The component of empathy, I think that is what I hope the nursing students got out of this workshop, is that they can think back on the workshop and say, wow, I remember how frustrated I was, being the patient and trying to explain to this nurse all of my symptoms, and they didn't get it. We didn't speak the same language.
So before we jump into the translations, I want to highlight the importance of cultural humility within the realm of healthcare. As healthcare professionals, we're exposed to diverse populations on a regular basis, and we need to be conscious about our efforts to not just try and communicate with these people, but also to connect with these individuals regardless of their status or backgrounds. According to Brookings, by the year 2045, minority populations are expected to increase and even surpass white majority populations to essentially become the new majority. So as these populations continue to grow and integrate, it is especially vital that as healthcare professionals, we try our best to educate ourselves so that we can address these health disparities and overcome these barriers within these populations. And this way, we can promote a sort of more universal and more accessible form of healthcare to our services and to our clients. So in one of our pediatrics courses in occupational therapy school, we had the opportunity to listen to a panel of mothers of Latin descent and their personal experiences within the healthcare system here in the United States, and it was very insightful. Although immigrants, particularly those of Latino descent, travel to the country seeking asylum, we learned that they become both a socially and politically vulnerable population. And as a result, both the quality and the accessibility to healthcare is even less compared to that of someone who is a US citizen in a system that we know is flawed, especially toward minority populations. And some reasons why healthcare is underutilized in Latino populations include a lack of knowledge or just the resources to navigate the healthcare system, a lack of bilingual or culturally competent case managers, social workers, providers, etc. And why we're here today, language accessibility. So in order to best treat our clients and optimize our own potential for providing the best quality of care, we need to be able to bridge these gaps in cultural connection. Something as simple as taking the time to learn basic communication with this population can help us do this. So I've included a link to a sort of cheat sheet to add to your OT toolbox with English to Spanish translations of common medical terms, body parts, symptoms, things like that that you would typically hear in a medical setting. So here comes the fun part. I'll probably repeat some of these a couple times so you guys have the opportunity to say it after me and join in if you'd like to. If you guys took something like high school Spanish, I'm sure you guys know how to greet and maybe ask somebody how they're doing. But just as a refresher, you'd say, hola, ¿cómo estás? If you want to replace hola with a different form of greeting like good morning, it would be buenos días. If you wanted to say good afternoon, it would be buenas tardes. Saying yes or no, something very simple. Yes is sí and no is no. If you want to let them know that maybe I'm sorry, I didn't understand, you would say, perdón, no entiendo. Let me say that one again. Perdón, no entiendo. One of the first things we'll ask during our interview with the client is kind of what brought them here, what happened, what's their purpose behind coming here. And I think the easiest thing to do would be to just ask them what happened, in which case you would just ask, ¿Qué pasó? But if you want to be like a little bit more clear, you can ask them, why are you here? In which case you would say, ¿Por qué estás aquí? I'll say that one again. ¿Por qué estás aquí? If you want to ask a client how they're feeling, you can say, ¿Cómo te sientes? ¿Cómo te sientes? Maybe your client will express pain, discomfort, something going on in their body. And I would go over these things in more detail, but honestly, trying to interpret these things might start to become a little bit difficult on the receiving end of things, because you have to consider that in Romance languages, each noun has their own gender. You have to consider conjugations and things like that. Like if I was gonna pretend to be a client right now and tell you that something hurt, the noun form of that word would just be dolor. But if I said, I'm hurting, it would sound like me duele. And so just that word hurt, depending on the tense, point of view, all sorts of things, the format of that word changes. And so it really depends on the syntax and kind of context of what that person is saying. And that's why I gave you a cheat sheet. Some simple things that can go a long way. Asking why is just ¿por qué? Where is ¿a dónde? And asking where isn't necessarily exclusive to like a place or location. It could be somewhere on their body. So this would be a great opportunity to practice charades and kind of nonverbal communication, like asking them ¿a dónde? Like, and using that form of nonverbal communication to try and connect with your client. If you want to say when, or even better, when did this happen, which is more relevant, you would just say ¿Cuándo pasó? ¿Cuándo pasó? If you just want to say the word when, just leave it at ¿Cuándo? Now, if you're going to treat someone and want to let them know what you're going to do that day, it can be very simple. If you want to say today we are, it sounds like hoy vamos a. Hoy vamos a. So let's say we're going to work on bathing today, and maybe upon entry to the room, your introduction would sound something like, Hola, ¿cómo estás? ¿Cómo te sientes? Hoy vamos a practicar bañarnos. This translates directly to, hi, how are you doing? How are you feeling? Today, we're going to practice bathing. A side note that I think is worthy of mentioning, when talking to someone older than you, or if it's somebody that you would maybe say, yes, ma'am, no, ma'am, yes, sir, no, sir, to, in Spanish, if you're going to say anything that has the word tú, which means you, I encourage you to substitute it with the word usted as a form of respect. I feel like these things will be the most helpful during the interview process and when you're checking up on the client. Again, we could be here all night learning, and that's why I gave you the cheat sheet. So for now, we're going to keep moving forward. So now I'm going to show you something really cool that I actually learned from a friend who's a PT at the burn unit here in Memphis. And he learned this because he had a client who is from Venezuela, I think, and she's a native from there and spoke exclusively Spanish. And he said that this was literally a lifesaver and made communication so easy. I played with this earlier today and I thought it was just so cool and goes to show how far technology has come over the years, and being able to bridge these gaps with technology. And so it's just the Google Translate app, which we've all heard of. You can download it onto your device. And whenever you open up the app at the top, you can choose which language you want to translate to and from. And then there's a little button with 2 microphones that says conversation. And so whenever you click on that, you can choose which language you're speaking from, and it'll translate to the other language that you chose. And so, for example, good afternoon, Mr. Gonzalez. How are you today?
Buenas tardes, señor González. ¿Cómo estás hoy?
No me siento bien hoy.
I do not feel good today.
I'm sorry to hear that, and we're here to help you. Can you tell me more about why you're here?
Lamento escuchar eso y estamos aquí para ayudarlo. ¿Puedes decirme más sobre por qué estás aquí?
La semana pasada sentí mucho mareo y me desmayé. Ahora no puedo sentir mi brazo derecho.
Last week I felt very dizzy and passed out. Now I can't feel my right arm.
So it's not perfect, but I think either side is easily understandable to whoever is contributing to the conversation. Finally, I do encourage you to try and learn some of the language on your own, because even the basics can go such a long way in connecting with your client and helping them feel comfortable with you. Some apps that I have listed include Duolingo, Memorize, and Babbel, and I'm sure there's a lot more that you can look up, but I'm also sure that this Google Translate app will come in handy whenever you need it. So I hope you enjoyed this in-service presentation and that it provided you with a lot of useful information for you to take with you into your future OT journey. Thank you.